probes for an apoprotein gene that existed. We were just very lucky. But it seems to have panned out in terms of larger studies now. Now, you could say that, why can't you combine then gene analysis with the Framingham score and get something better? And actually, this was done. So what was done here, there are something like 18 polymorphisms looked at. You can do things much easier these days than when I was studying in 1985. And they've screened thousands of patients and looking at, in this case, 18 different gene variants. And what they did was then follow these patients up for a number of years and then looked to see how many patients actually died over that period. And as the numbers of those polymorphisms increased, the numbers of patients who died over that 12-year interval increased too. You can see that here on this diagram. But then when you try and match that up, and what this shows is the ROC curve with or without that polymorphism data included. And really, there's no difference between those two means of testing. I'll try and come back to that later. I'll leave that question hanging. One of the other things that we know very well is that inflammation appears to be very important. You may have heard on the news recently that there is a way of imaging coronary arteries that could predict cardiovascular events, that is a heart attack. Inflammation seems to be very important. The reason it's important, I explained right at the beginning, that it causes rupture of the plaque, and the plaque ruptures and then becomes clotted out because of the fact that it presents to the blood a very thrombogenic surface, and the patient then dies. So what is the difference then between a plaque that will rupture and one